Hi friends, in this video we will discuss about the thyroid gland, and it is an important essay question in the university exam, and the main headings will learn from this topic are small introduction, second one is the location, then parts and features, capsule, relations, arterial supply, venous drainage, and the nerve supply. First, give an introduction. The first point is thyroid gland is the largest endocrine gland in the body. The largest endocrine gland in the body, and it is butterfly shaped gland. Next one is the location. That is the location. So we can understand the location of the thyroid gland with the help of this diagram. Okay. This yellow colored structure is the thyroid gland. The thyroid gland is located in the lower part. This is the neck, and thyroid gland is located in the lower part of the neck and the front portion of the neck and the side portion of the neck. So, the thyroid gland is located in the lower part of the front and the side of the neck, opposite to four vertebrae, C5, C6, C7 and C1 vertebrae. And this is the trachea clasping the upper part of the trachea. And the next heading is the parts and features. Parts and features. The parts and features of the thyroid gland we can understand with the help of this diagram. And the first point is thyroid gland is H-shaped. Thyroid gland is H-shaped. Okay. Thyroid gland is H-shaped, consisting of right and left lateral lobe. These are the lateral lobes. Okay. And a horizontal isthmus. This is the horizontal isthmus connection between these two lateral lobes. Okay. This is the first point. Okay. And the next point is sometimes a small pyramidal lobe. This is the pyramidal lobe. Okay, just like this. Okay. Sometimes a small pyramidal lobe projecting upwards from the isthmus, and it is connecting to the body of the hyoid bone by a fibrous or a fibromuscular band is called levator glandulae thyroideae. Okay. And the next point is each lateral lobe of the gland extending upwards to the oblique line of the thyroid cartilage. This is the thyroid cartilage, and the lateral lobe extending upwards up to the oblique line of the thyroid cartilage, and below up to the, this is the fifth tracheal ring, below up to the fifth tracheal ring. This is the extension of the lateral lobe. Okay. The next point is, and this is the isthmus, and the isthmus is extending across the midline. This is the midline, and the isthmus is extend across the midline in front of the second, third, fourth tracheal ring. Okay. And the weight of the gland is 25 grams. Okay. These are the points included in the parts and features. Okay. Next is the capsule. Capsule of the thyroid gland. You can understand this, the capsule with the help of this figure. And the thyroid gland is invested by two capsules. What are the two capsules? Inner true capsule and also outer false capsule. These are the two capsules that covers the gland or protect the gland. Okay. This is the inner true capsule and this is the outer false capsule. This red dotted line. This is the plane of cleavage and these are the thyroid veins. Okay. And the true capsule. The true capsule is formed by the peripheral condensation of the fibrous stroma of the gland. And what about the false capsule? It is derived from splitting of the pretracheal fascia. And the false capsule is thin along the posterior border of the lateral lobes. Okay. The false capsule is thin along the posterior border, and it is thick along the medial surface of the lateral lobes. And the thick medial surface of the lateral lobe forms the suspensory ligament of Berry. Okay, suspensory ligament of Berry. Okay. And the next is the relations of the thyroid gland. Each lateral lobes are roughly pyramidal in shape and it consisting of an apex, a base, three surfaces and two borders. What are the three surfaces? Superficial or lateral surface. And second one is medial surface. And third one is posterolateral surface. And the two borders are anterior border and posterior border. First is the apex. Apex is extend up to the oblique line of the thyroid cartilage. Okay. You can study it with the help of this diagram. This is the lateral lobes and this is the apex and this is the base. Okay. So the apex is extend up to the oblique line of the thyroid cartilage and the apex is sandwiched between the inferior constrictor medially and the sternothyroid laterally. Remember with the help of this word in STEM. Okay, in STEM. In means inferior constrictor and STEM means sternothyroid. Okay, inferior constrictor medially and sternothyroid laterally. Next is the base. The base is extend up to the 5th or 6th tracheal ring. Just look at the picture. And this is the base and the base is extend up to the 5th or 6th tracheal ring. Okay. And next is the superficial or lateral surface. Superficial or lateral surface is always convex in shape and it is covered by 3 strap muscles. Which are they? Sternothyroid, sternohyoid, superior bilio-obohyoid. And the anterior border of the sternocleidomastoid overlap it inferiorly. This can be understood with the help of another diagram. Okay, this is the diagram. This is the superficial surface. Okay, this is the superficial surface. It is convex in shape. And it is covered by 3 strap muscles. Okay, as one, the muscle which will lie lower position is sternothyroid and just above that the sternohyoid and this is the superior bilio-obohyoid and this is the sternocleidomastoid and the anterior border of sternocleidomastoid mastoid overlap it inferiorly. Okay. It's all about the superficial surface or lateral surface. And the next is medial surface. This is the medial surface. Okay. Medial surface. And it is related to two tubes, trachea and esophagus. This is the trachea and this is the esophagus. Okay. And two muscles. Two muscles are inferior constrictor and cricothyroid, and the two cartilage, cricoid and thyroid cartilage. And the next surface is the posterolateral surface. Okay, this is the posterolateral surface. Okay, posterolateral surface. The posterolateral surface is related to the carotid sheath and its content. Okay, this is the carotid sheath and the content. What is the content of the carotid sheath? Here we can see that the common carotid artery, internal jugular vein, and the vagus nerve. Next is the anterior border. Anterior border is thin and it separates the superficial and the medial surface. Okay. This can be remembered with the help of thin SM. Anterior border is thin and it separates superficial and medial surface, and it is related to the anterior branch of the superior thyroid artery, and the posterior border is thick and it is rounded, and it separates the medial and the posterior surface. This we can remember with the help of thick MP. Okay, thick. Posterior border is thick and it separates the medial and the posterior surface. Okay, surface. And it is related to longitudinal arterial anastomosis between the superior and the inferior thyroid arteries and the parathyroid glands. Okay.